Ladies and gentlemen, Dr. Ryan Livingston here, coming at you with a wonderful article or a dissection of an article, so to speak, of a couple common objections that I find in chiropractic. I want to give you a quick, succinct explanation from a chiropractor who does structural corrective care. I work with a lot of surgeons, attorneys, so we have to have a very high level of medical consensus. Work very well with Western medical providers, providing very extensive care treatment protocols, X-ray imaging, advanced imaging, MRIs, et cetera, et cetera, et cetera. And these are just some common things that I come across with in the public that I actually don't get asked too often anymore. Not sure why, but let's go over them. So number one, this was an article talked about 5 reasons to fire a chiropractor. Some really good things to think about. And I used to get asked these questions too, so I totally get it. First and foremost one they picked to talk about was long-term treatment plans. Treatment care plans costing thousands of dollars, last several months, and talking about being properly aligned. So basically they're saying find a new chiropractor if that's what they tell you. Okay, so first and foremost, I guess I actually kind of already answered that question, being the fact that whether the person's actually going to get surgery. Number one, specifically what I do is like the orthodontists of chiropractic. We are the orthodontists of chiropractic. There's your typical chiropractor who adjusts, and that is the most important thing that you can do is to restore joint function, to lubricate those spinal joints, those specifically the vertebrae. But these joints here that you can see, and the reason you adjust is to facilitate the neurological rewiring of those joints and to get them to move and fire properly again. Why? Because in order for your spine to allow your nerve to communicate with the rest of your spinal cord, and for that nerve function to flow optimally, i.e. latency, amplitude, the response develops appropriately and quickly and effectively. We won't go down that rabbit hole, but for the neurology to work the way it was designed to work, and the best way it was designed to work, you've got to have a nice, normal, healthy spine from front to back and then from the side. If you lose that curve, boom, like that, you've got a lot of dysfunction, a stretched spinal cord. So now you've got the spinal cord has tons of issues, which can cause all kinds of neurological things, from symptoms like multiple sclerosis, Parkinson's, to headaches, chronic fatigue issues if it's in the upper cervical region, to loss of sensation, numbness and tingling, overall fatigue, fibromyalgia, chronic central sensitization, which is essentially fibromyalgia. Your body becomes increasingly freaked out by any little nerve or irritation. So your body responds really quickly and easily to a stimuli, aka if someone just pushes a little bit on you, no matter no matter where they push, you're in a lot of pain, and it's not just inflammation. That's essentially what fibromyalgia is. But that comes from a stressed out spinal cord, literally being stretched and squeezed and tethered, and loss of normal healthy spinal curvature. They should be straight up and down from the front and the back, but you don't know that if you don't have imaging. So in order to correct that, in order to get a healthy response, you've got to use equipment, and that takes long-term treatment care plans. And way more people have this than realize. The number 1, 4, and 6th leading causes of chronic pain and disability, because you'll find out in all of my other episodes you've probably watched that I don't care about pain. And I say it in a nice way, in the fact that, like, oh, I'll help you get out of pain, but what's more important than get out of pain? Because you can get out of pain in a few adjustments, if not even just one adjustment. I've had plenty of patients that have had migraines for over decades, and with the first adjustment, their migraines are gone. But is that going to fix a neck that looks like this? No. The primary cause of migraines is loss of cervical curve and issues in the cervical spine, cervical instability, etc., which don't get picked up if you don't do imaging. But in order to fix this, back to nice, normal, healthy, you've got to have a care plan that can do that, and it can accomplish that. And even better, it's great when you have the medical guidelines to facilitate that. In fact, here's one of the primary books, cervical spine, that has a lot of the guidelines and clinical implications of how to build those care plans. On to the next thing. Think twice before coming back for a second visit if your chiropractor doesn't treat you on the first visit because they need time to read your x-rays and develop a care plan. They're lying. Sorry, I want to make sure you don't understand me. Chiropractors are well trained coming out of school. Even when instance of information is available, you need extra MRIs reports. Your chiropractor should be able to provide you some relief on your initial visit. So he's talking about coming back for a second visit and then going over findings. So far I've agreed with. I agree with these concepts. I don't like the language he's using. It's very implicative or assertive. Saying they're lying, that's absolutely false. I don't know what this dude practices, but he doesn't practice well. They're not lying. It takes a lot of time, energy, and effort to go through an entire series of x-ray imaging, analyze it, look for cancers, pathologies, but more importantly, to analyze using the same surgical guidelines. You've got to analyze where the spine is at in space and its structural alignment. You've got to measure every single vertebrae. You've got to measure it with motion studies, Mosage imaging. And if you've got a very busy practice, this already takes several hours. And then to compute the report, then to look over the report, find the areas of instability, find the areas that once you stitch the whole spine together, which area is causing the major distortion. So which areas do you need to address? How do you need to set up the rehabilitation? Which rehabilitation exercises and advanced rehab do you need to do to traction that spine? Which equipment are you going to use to traction that spine? Are you going to use extension compression equipment, or are you going to use just a regular flat dental roll orthotic for the patient? Are you going to use what's their sacropelvic angle? What's the pelvic morphology? Are you even going to be able to get correction out of the lower lumbar curve? Or is it all coming from above the lumbar region, and that's really why you're seeing a loss of lumbar curve? Like, that was 10 seconds of explanation, and you're probably already like, what in the heck did he just say? Saying that you have to come back is lying. Ugh. When I hear stuff like that, not for nothing, but I almost want to like send them a letter and be like, take this stuff down. But I won't. But okay, so tunnel vision. Actually, and more importantly, I find that with my patients, they are way blown over the first day exam. They're touched so much through all the exams we do, through all the imaging we do, the analysis, the neurology, the orthopedic test. Their brain is fried just from the information overload. So saying that's, I mean, my patients love that we space things out. So I find the exact opposite to be true. And further, you get way more time to sit down and talk about these things. Come up with a game plan, because it's not just about what do you do. Like, I can tell you what we need to do to fix your spine, but more importantly, how are you going to be able to incorporate that into your life? Because exactly like he said before, and exactly like the medical guidelines dictate, you've got major cervical issues. This is just the neck. You've got major instability coming from whiplash. Again, I talked about working with attorneys. That's where the majority of these very severe injuries come from, and primarily only come from are very severe traumatic incidences that happened at some point. You've got to be able to work with a person, work with you to come up with how are you going to be able to fit this into your life. It's very easy and simple, but you've got to sit down and go through that process and map out, okay, Monday, Wednesday, Thursday are the days that I can commit to coming in, getting adjusted, and then doing my rehab when I'm in the clinic, but I don't really have time to do them in the clinic on Monday or on Wednesday and Friday or whatever. And on Wednesday and Friday, and maybe on a day on the weekend is when I'll do my orthotic, etc. Like, that takes time, right? If you want the Bentley, the Gucci, the Louis V, whether you're into that mainstream stuff or not, those companies are known for their quality, their excellence. If that's what you want out of your doctor, your structural corrective care chiropractor, you really want to fix the issues and get to the highest quality of life possible. Like, why we also work with corporate companies to facilitate that their employees are working at the top 5% margins are where they need to operate. And if they just lose that top 5 to 10%, then then their employees, they're not worthless, but they're not going to meet their deadlines. They're not going to meet these huge projects that they've set out to conquer. They're not going to meet their sprints. Like, companies fall apart and hinge on the top 10, 5, 10, 15% percentiles. So you need time to go over that stuff. Okay. So that's my opinion. And I guess that's who we attract. Tunnel vision. If your chiropractor's only fixed on adjusting your spine and not combining, adjustment only, not combining manipulating your spine with muscles, long-term strategy, long-term strategies, strengthening exercises, or lifestyle modifications. Beware of a lookout. Okay, we cover all that. I totally agree with him. We go, as we're going through care, not only do we introduce the exercise, you need to rehabilitate your spine and get this curve fixed and the spine properly aligned and those curves back in your spine. As we're going through that, we're also teaching you, and then from front to back, you want it to be straight. Not only are we aiming to get you there, but once we get you there, how do we keep you there? How do we keep you there, right? You got to do spinal hygiene exercises at your house. We give a perfect example. This is behind my back. As you can see, it's quite well used. That's once you fix your spine. You use some type of roll up a freaking towel if you need to. Really tight roll up a towel. Put it behind your lower lumbar back. We'll teach you exactly where to put it because that is important. Don't put it in the wrong spot. You're worse than things. Here's an example of spinal hygiene at home. Like, you need to do exercise at home. Once you transition and you graduate from exercises that are specifically geared towards fixing your spine, then you graduate to hygiene, like common normal hygiene. Hey, now that my spine is relatively healthy and the shape and structure is back to normal, it's functioning well, adjustments are way less frequent. Why? Because your body is in a position where it can withstand that. Or if you're an elite athlete that's, Phil Heath, any of the major athletes are getting adjusted 4 or 5 times a week. Why? They're exposing their bodies to stresses that it wasn't meant to handle. And so you need to keep those joints moving, grooving properly, and keep those nerves firing and functioning properly, because that spine needs to be put back in place along with the exercise you're doing at home. So you got to have a game plan, and that goes back to his first comment and his second comment, actually. Long-term treatment care plans, extremely essential. Why? Because as your care starts to drop off in the clinic, it increases at home. If you stop doing the stuff at home, then your care in the clinic is going to increase again. Why? Because you're not doing the things to stabilize and strengthen and keep you where you're at. Otherwise, you're just going to succumb to everyday poor, chronic, repetitive posture over time. In addition to, if you're an elite athlete or just a weekend warrior, you're putting your body through those stresses that it can't handle anyways. Or corporate stress, mental stress is a huge problem. Sitting for hours and hours on day is a huge problem. Okay, so comment number 4 he talks about is beware of pill pushers. The supplements, manage your condition on your own. Importance of diet and supplementation. Buyer beware if they're more concerned about selling pills than treating your condition. Yeah, sure, totally agree with that. I would also caveat that to say, though, if you walk in thinking that your chiropractor is just selling you supplements, that's just stupid. I'm not exactly sure. I apologize. I'm not exactly sure why this was even said. I feel like it could have been said in a much better way. I actually find the opposite. Again, I find the opposite. Maybe it's because of my decades of personal training and nutrition experience, starting a fitness and bodybuilding club at my university, specifically because I couldn't get into the dietetics program, because I wasn't in the dietetics program. I couldn't start or be in that club, even though I wanted to learn all about nutrition and get involved in that stuff. So I had to start my own club. So I teach nutrition a lot. I'm very, very well versed in nutrition, and I would tell you there's no better doctor to go to talk to about nutrition than myself, or somebody of my perspective, right? So I would implore you to go to a chiropractor before I would implore you to go to a medical doctor if that's who you're going to seek for nutrition, because we tend to be 9 times out of 10 way more into the nutrition and aspect and the whole body functioning. So I find the opposite. If you want If you want good diet information, sometimes it has to start with supplements. Sometimes you need a very strong, potent supplement to start off to get a lot of good. Look, you need habituation. Not only do you need habituation, you need motivation. Patients are people. People are patients. If you can take a curcumin tablet and get very good relief. Sorry, this is going on long. 15 minutes already. So if you can get good relief from a curcumin tablet for the first couple of weeks, and then as you're doing that, start to transition into cooking with turmeric, dude, that is the world's game changer right there. Like, turn it into a lifestyle habit, and then slowly wean off the supplement, or keep using the supplement, but maybe use it way less frequent. That's the key there. That's what I teach. I find my patients love supplements, and the irony is I don't actually even use that many with them. Last comment he has is free X-rays. You don't want to go to chiropractors offering free X-rays. Again, I actually don't do that. I don't agree with him, however, though, because it is a very good way to meet the public where they're at. You know, how much of the stuff that I just explained did you already have a question about or completely unaware of? You didn't even know, most people don't even know how many things your spine controls and how and why. You've heard that the chiropractor, your friends, oh, I used to have headaches, migraines with auras, classic migraines. I started getting adjusted and I don't have them anymore. Or I had asthma and allergies or acid indigestion and I don't have it anymore. And all I changed was seeing my chiropractor. I don't even eat any better. Or I had menstrual cramps and I don't have cramps anymore. Or I'm trying to think of like super common one. Here's a funny common one for typically elderly population, but erectile dysfunction. Why that's kind of so funny to me, and hopefully you'll agree, is not because that's funny, but it's because they don't talk about it. No one ever wants to talk about that. But it's the first thing that they mention without me bringing it up when they start getting adjusted. It's like, hey, can this help with this? And it's usually the wives or the spouse or the significant others that were like, hey, does this have anything to do with this? Because I started noticing changes with my husband in the bedroom, or things of that nature. And I'm like, absolutely it does. And then I will actually bring their paperwork back and be like, hey, you remember when you filled the paperwork out and we had this section here and you check mark this or you didn't check mark this? I'll be like, we put that there for a reason. Like, we talk about lower pelvic, lower lumbar regions and organs that are innervated, because once you start getting adjusted, if you've got dysfunction in those areas and your X-rays show major distortions or translations or degeneration in that area of your spine, more likely than not, your issue is coming from the spine, not from XYZ. So as we fix it, that's going to get better. So I actually think offering free X-rays in addition to the exam is a great way to meet the public where they're at. If they don't know something, why not offer an incentive? It's an incentive. Don't call it a tactic or let's be real here. People want to be included in the conversation. They don't want to be spoken at. And not everyone's a skeptic. And so you shouldn't go in talking like the person you're with is a skeptic. And that's certainly the language being used here. So hopefully you appreciate my commentary on that. From time to time, I will do incentivized action taking things, and I find that not only do I find it beneficial indirectly, but patients will even tell me, like, I'm so glad that you offered XYZ at this event because I was looking for a reason to excuse me. I was looking for a reason to check out a chiropractor, and I kept thinking about it, but I never wanted to take the jump. I'm not really sure why, this, that, and the other thing, I love the phrase looking for a sign, and I totally am very, very much positive about manifesting and speaking life into things and opportunities presenting themselves, and this aligns. I mean, maybe I just went a little too deep on that, but this aligns perfectly with that. If you're giving an opportunity for someone to jump in, people love that. They just do. So, okay, so those are the 5 things he talked about. Hopefully those 5 reasons to fire a chiropractor are the 5 reasons why you would want to see a chiropractor, now that I've explained some of these common issues. Now, yes, you've got to have the right person for the right task, and that maybe that takes a little bit of investigating to see if that chiropractor functions and operates that way. So put in a little bit of time and effort, or call ahead, just call and ask. Okay, Dr. Ryan Livingston here, signing off. Remember, what we do as chiropractors, crack the heels.